Good evening, everyone. You're all very welcome to this webinar, which is being held to mark Eating Disorders Awareness Week, which took place last week. Now, tonight's webinar is 90 minutes, and we're going to split it into two sessions. The first one will run until around 6:40, and that's going to feature members of the multidisciplinary team on St. Patrick's Eating Disorders Service. And they'll present a comprehensive overview of binge eating disorder and some of the associated treatment options. After that, we'll take a 5-minute comfort break before returning for a second session. Now, that's going to be a panel discussion with 3 experts by experience, as well as a social worker on the eating disorders team. And as always, we're so grateful to experts by experience to give of their time and their experience, because it's always so valuable. And certainly in the feedback for these events, attendees always mention how helpful and useful they find those contributions. So we're looking forward to meeting those experts, and we thank them greatly for their time. During that panel discussion, we'll be exploring themes such as seeking support, treatment for eating disorders, the impact of stigma is a big thing, and obviously the role of family members or supporters in someone's recovery journey. You'll have an opportunity to ask questions in both of the sessions. And if you have any questions, you can just submit them via the Q&A box below through the webinar. Sometimes people, get involved in chat, which is also fine, but the Q&A box is better for questions because we can direct it better, and sometimes we can answer the question within Zoom, and sometimes we'll put it to people. So if you could use that box, that will be great, and we'll try and get through as many as we can. Now, for anyone with accessibility requirements, you can turn on closed captions by clicking on the live transcript function in your Zoom window. In the coming weeks, a recording of this evening's webinar will be added to the St. Patrick's YouTube channel, so you can watch it back. And we'll also share it via email with the PowerPoints from the first session afterwards. So if you're attending and you've supplied an email address, we'll get that to you. I'm going to hand over now to our clinicians for the first session. So I'd like to welcome members of the Eating Disorders Multidisciplinary Team at St. Patrick's Mental Health Services. Michelle Ward is the candidate advanced nurse practitioner in eating disorders, and Claudia Banfi is a registered psychiatric nurse in the Eating Disorder Daycare Service. So Michelle and Claudia, if you want to turn on your video and mics there and bring us through your presentation, that would be great.
Good evening, everyone. Thank you very much for joining us, and we're very pleased to be here this evening to be able to talk to you about eating disorders. Particularly binge eating disorder is the focus for the first part of the presentation, as Jan mentioned. Myself and Claudia both work in the eating disorder team in St. Patrick's, and would like to be able to kind of present some of the work that we do in St. Patrick's to you. I'll just go through a little of what we're going to be speaking about. I will give kind of an overview of binge eating disorder. I will talk through the treatment options available for binge eating disorder kind of broadly and more specifically in St. Patrick's. And then I'll hand over to Claudia, who will speak about the binge eating daycare stream that we run in St. Patrick's. How we ran a pilot scheme, how we noticed the need for it, and present on what currently is happening on daycare for binge eating disorder. So I'll start with a very kind of, I don't want to say a simple concept, but I suppose an overview of what is a binge. I took a snapshot of a dictionary quote, and while people will be familiar with it, it's just to really highlight that a binge would be an unrestrained and often excessive indulgence. And it even references here that it can be part of an excessive or compulsive consumption of food, or in this case, they give the example of alcohol as well. In relation to a more clinical definition of binge eating disorder, it would be referred to as a recurrent, brief, psychologically distressing episode during which individuals can have a lack of control, can consume larger amounts of food than most people would under similar circumstances. It's really, really important today to highlight that binge eating disorder is the most common eating disorder, while anorexia and bulimia, even RFED or eating disorder not otherwise specified, are there and may be more common for people to hear about. Binge eating disorder is the most common. It affects approximately 2 to 3% of adults in their lifetime. I'll go into the details of it, but it would a binge pattern would occur at least 1 day a week over the period of about 3 months, and a binge period would be for a specific amount of time, usually around 2 hours, less than 2 hours. I'll go on to look at the DSM criteria for binge eating disorder. Again, it's looking at a recurrent episode of binge eating for a specific period of time, and having that lack of sense of control over the episode, feeling that you can't stop eating or control how much you are eating. Another criteria is that you might eat more quickly, more rapidly than normal. You would eat until you feel uncomfortably full. You would eat maybe large amounts of food when not feeling physically hungry, or that you may have had your meals for the day and still feel the urge to eat. You'd often eat in secrecy or eat alone because feeling embarrassed by how much you're eating, or just the act that you feel that you have to eat or you have to have some food. And it's often associated with feelings of disgust, feeling stressed or feeling very guilty after the period of overeating. Again, a marked distress regarding the binge itself or the ongoing act of binge eating is there. As I said, it occurs at least 1 day a week over the period of 3 months. And it's important to kind of note that it's not associated with other eating disorders. It wouldn't be associated with compensating behaviors like purging or fasting or excessive exercise. And as I said, it's not associated in conjunction with other eating disorders. Although binge eating can be features of other eating disorders, we're looking at these particular criteria when we're looking to diagnose binge eating disorder. While that's the DSM that I've kind of focused on there, the ICD, and I don't want to be too clinical on this, but it does give a good overview, I think, for those to have a good understanding of it. It's really about kind of having frequent, recurrent episodes of binge eating. It's looking at eating for a distinct period of time and having that loss of control over your eating. And again, it's like having different patterns to how your eating is, in that you feel that you'd be eating differently to how you'd eat a typical meal. The On how distressing the action is, feeling negative emotions such as guilt and disgust. And as I said, it doesn't have that compensatory behaviors like purging, laxative use, or exercise. Going on to the next slide. Thank you. It's the clinical features of binge eating disorder. There's increasing evidence that this disorder is not only occurring in adulthood, but also can occur in adolescence and childhood. I suppose the average onset would look at from late teens to early 20s. And I suppose, as with most eating disorders, the earlier onset is associated with worse outcomes and requires more complex interventions. With binge eating disorder, there's can be high levels of interpersonal problems, and the perceived quality of life can be lower in BED than in non-BED populations. 50% of those with binge eating disorder would have a BMI in the overweight or obese range. There's association with poor impulse control and poor emotional regulation. 80% would have a lifetime prevalence of at least one other psychiatric disorder. And I think, again, it's important for the clinicians this evening to take note of this, that while we may be looking at treating one um, diagnosis, maybe depression, anxiety, that it's also to be aware of how people are managing those emotions and to kind of consider, does this person have an associated eating disorder, binge eating? While we don't want to be just diagnosing, it's important to kind of have a appropriate diagnosis in order to engage with the treatment and to have a treatment plan in place. Fortunately, sorry, that's okay. I was just going to mention about the suicide attempts prevalence in binge eating disorder is quite high compared to others. It's 23%, so that's between 4 and 5 times greater than in the healthy population. While with a lot of eating disorders, people would think that they're relatively new, and we often hear that, oh, binge eating is something new, or it was first described in 1959, so quite a long time ago, and formulated into a diagnosis in the 1990s. It took a while to be introduced into the DSM, and there's a lifetime prevalence in women of about 3% and in men of 1%. And the prevalence increases in individuals at a higher weight, as I mentioned earlier. So what triggers a binge? It's, I suppose that's a significant question for anyone who's suffered with binge eating disorder. And this is only, I suppose, a snapshot of things that may trigger a binge. Under eating, dietary lapse, if you're trying to stick to a particular diet, and not being adherent to it, that kind of sure, why not? I've lapsed now, I haven't continued on, I may as well do this and I'll start again fresh tomorrow. That can be a factor. Alcohol, emotional distress. Having unstructured time is something that we also get a lot of feedback on. Feeling alone or being alone. Feelings of fatness, feelings of shame around the weight, feelings of shame around body shape, gaining weight, and premenstrual tension. And I kind of wanted to emphasize that because the endocrine changes, puberty, pregnancy, menopause, are particularly complex factors when it comes to eating disorders. While pregnancy can be protective for eating disorders, it's also a very vulnerable time for binge eating disorder onset. Uh, and menopause transition is also quite a vulnerable period for the development or re-emergence of eating disorder behaviors and binge eating disorder. So I think it's notable to kind of that premenstrual tension to kind of have that mentioned tonight. With all eating disorders, that people can be living with an eating disorder, they can look healthy, and yet they can be extremely unwell. Eating disorders and binge eating disorder is not separate to this. They're associated with somatic complications in multiple organs: cardiovascular health, gastrointestinal health, endocrine health, as I mentioned, neurological kind of health as well. Complications can emerge at any time during the course of the illness. And the more chronic and severe the eating disorder is, the greater the likelihood of these medical complications. While it's not just the medical or the physical health point, is that the eating disorder is a health crisis and it disrupts personal and family functioning. It day to day, it can interfere with how ready and available someone is to be able to engage. Disorder can be produce quite a financial burden with people and in their families. Um, just this week, I was speaking to a service user about kind of how much they've spent on their paycheck, and it was that they'd spent it all on food. Other cases are kind of parents having to kind of constantly budget and hide food away because they are struggling to keep food in the house with people who are binge eating and engaging in binging behaviors. Eating disorders interfere with the healthy development physically, socially, and psychologically, and can interfere with intimate relationships, reproductive health, and parenting. When we look at treatment for eating disorders and specifically for binge eating disorder, we're looking at a step model of care. We're looking at a multidisciplinary approach. Treatment for binge eating disorder will look at psychoeducational interventions, psychotherapeutic interventions, behavioral options, and there are pharmacological options too. And I'll go through each one of these now in a bit more detail. Looking first at the psychoeducational interventions. This looks at improving our understanding of eating disorders, binge eating disorder, reducing the stigma around it, reducing the shame and isolation. We're looking to promote a deeper knowledge of the condition. We're looking at what predisposes, we're looking at the triggers, we're looking at what maintains those eating impulses. Want to teach skills to avoid restriction and to help with food monitoring. With psychoeducational interventions, it doesn't require specialist input. It can be delivered one-on-one or in a group. And the psychoeducation does show efficacy in binge reduction and in the eating impulsivity. Psychotherapeutic, psychological interventions, these are the most valid and effective for binge eating disorder. Looking at cognitive behavioral therapy or CBT, this focuses on the basis of the binge eating, the relationship that the service user has with self-esteem, and the excessive focus on body image. CBT is flexible and adaptive, and the remission rates suggest to be about 50 to 60%, which is significant. Individual or group CBT both show similar results, and the self-help, there's good efficacy for the self-help or the guided self-help with CBT. DBT or dialectical behavioral therapy has a similar efficacy to CBT and binge reduction. That looks at lowering the concerns around food and body shape. It promotes a stronger focus on emotional regulation and the skills around that, and looks at stress and de-stress tolerance. Interpersonal therapy, IPT, as some people might refer to it as, is particularly effective where there's patterns of relating to negative effect that might underlie the negative, or that might underlie the binge eating disorder. CFT CFTE is compassion focused therapy for eating disorders. This will be the main approach used on our program in St. Patrick's and by the psychology department. Compassion is defined as a sensitivity to suffering in the self and in others, with a commitment to try and alleviate and prevent that suffering. With the CBTE, the people that are most likely to benefit from CFTE are individuals experiencing an eating disorder, people who struggle with shame, guilt, and self-criticism, but also people who don't require supervision for their eating and have expressed a desire to want to recover. We do have a set criteria for the BMI range for people engaging in the CFTE program. And it is a program in St. Patrick's that GPs can refer directly to, that they don't need to be under the care of one of the psychiatrists in the hospital or the teams in the hospital for that. Looking at some of the behavioural interventions, we look at dietitian support, the nutritional needs of the person, meal and snack planning. The emphasis is not to promote weight loss, it's to promote a healthy relationship with food and to reduce the eating behavior. It's looking at promoting physical activity and the development of other interests and activities. Unfortunately, it's unlikely to be as effective as a standalone treatment to others, and it is associated with higher dropout rates and lower remissions of BED symptoms. I do just want to mention the pharmacological options. There is a recommendation for lisdexamfetamine and topiramate. There's some recommendations for SSRIs, antidepressant therapy, sertraline, escitalopram, and atomoxetine. There can be a pharmacological treatment of binge eating disorder with other psychiatric disorders if there is treatment already in place. And there can be consideration for the role of the anti-obesity medications if that's necessary and relevant for the person as well. There is a significant treatment gap in binge eating disorder. Unfortunately, only about 38%, so with a lifetime history of binge eating disorder, ever receive a specific eating disorder treatment. An online survey in 2016 found that only 3%, 3.2% of individuals who met the criteria for BED had received a diagnosis from a health provider, and less than 10 to 50% of individuals with BED receive care in high-income countries. Just to make people aware of some of the self-help resources out there, and I understand that the slides will be available along with the video. Chris Fairbairn's book, Overcoming Binge Eating. Obviously, the copy is there. I'm not just promoting that. It was just the one that I was able to get up. Then there's the DBT solution for emotional eating. That's the dialectical behavioral therapy that I discussed earlier on. And then it's Overcoming Your Eating Disorder, a CBT therapy approach for bulimia nervosa and binge eating disorder. They're some of the self-help books that will be recommended for treating binge eating. I'm going to pass you on to my colleague Claudia now, who's going to talk about the development of the binge eating stream daycare in St. Patrick's. Thank you very much.
Hi everyone, thanks Michelle for that. My name is Claudia and I am one of the nurses on the daycare program. And we're just going to talk a little bit about how we developed the binge eating disorder stream on the daycare program. So the general program started off as a blended approach. So it was 2 days online and then 3 days on site. But what we, the nursing team, observed is that the majority of those experiencing binge eating disorder had difficulties with full engagement in the groups. And once we noticed that, we decided to ask for feedback from those individuals. So on the next slide, we see that the service users with BED, they did not share the same interests or the same experiences as those with other eating disorder subtypes. They found it shameful to talk about their experiences of binge eating within the group. They were concerned that talking about their own experiences of body image or their binge eating behaviors would be triggering for service users who experienced other eating disorders. And they also did not feel understood or heard. Because of this, us as a team decided to create a program that would be more suitable for those with binge eating disorder. So the pilot program consisted of partially separate streams for the general eating disorder program, where service users experiencing binge eating disorders attended 1 day online and 1 day on site. The aim of separating the groups was to give the service users with BED experiences a safe space to discuss their experiences without fear of triggering others, while also providing them the opportunity to be understood and heard. The development of the BED stream was based on NICE Guidelines 2017 and BodyWise 2015, a guided self-help approach which included self-help skills and psychoeducation on BED. So our first pilot program started in February 2023. The EDP Daycare commenced a pilot program for service users experiencing binge eating disorder. The online groups included promoting a positive self-image and a BED specific nutritional group with a dietitian. The BED stream was merged then with the general eating disorder stream for the on-site occupational therapy community group and decider skills group. So the introduction to group compassionate mind group was later made available to those attending the BED stream on an individual needs basis. So after the pilot program, we then looked at some feedback from the group. Generally, all content was relevant and useful, but sometimes there was a lot of information, particularly when it was all completely new. However, no service users wanted any information to be taken out. All service users reported that they would like the program to be longer than 8 weeks to allow them to process information, reflect, and put things into practice. The service users reported not feeling judged in any of the groups and felt supported by each other to share personal experiences. And then the hybrid model on-site online suited the needs and lifestyle of all service users. On the next slide, we then made some updates, of course, after hearing the feedback. So we decided to keep in with the findings from a study examining an outpatient group intervention for people experiencing BED. The length of the program has been extended to 12 weeks duration. So now we're doing 12 weeks instead of the 8 weeks. Compassion-focused therapy for eating disorders, so CFTE, is an evidence-based treatment that addresses the experiences of shame and self-criticism for people with eating disorders. The introduction of the group Compassionate Mind was included into the BED stream as well. Because service users reported a high level of shame and self-criticism in relation to regular weighing, it was then decided that weight would be monitored less frequently than those attending the general eating disorder program and would be on a needs choice basis. So now the Binge Eating Disorder Programme is a 12-week program run as part of the Eating Disorder Daycare Service. This program is run through a hybrid model, and it's 2.5 days per week, and then an optional 3 days if the individual wants to do the afternoon group on the Friday. This program is delivered through an online format on Tuesday, and the program is on site in the St. Patrick's University Hospital, Dublin 8 campus on Thursday and Friday. This program aims to help service users navigate and gain an awareness around difficulties in relation to binge eating disorder, development of skill and tools in order to manage difficult emotions are part of this program. There will be self-directed learning as well, and an opportunity for reflective work. The BED program includes regular one-to-one nurse practitioner and dietetic reviews and evaluations, medical monitoring of physical and laboratory status. So we do your blood pressure, your weights, you get your bloods done as well. And then that's also some time just to have a check-in with the nurse to see how things are going on as well for the individual. Meal support and post-meal support therapy. Nurse-led group work on body image, guided self-help for binge eating, CBT, so cognitive behavioral therapy, and DBT, dialectical and behavioral therapy based skills. Psychology-led group on introduction to compassion-focused therapy, occupational-led group on living skills, and community outing to develop living skills, and dietetic-led group on nutritional psychoeducation. And then we have here, sorry, the program. So this is basically the timetable for the program, and it has here all the different groups that I've just mentioned. So on Tuesdays we have it's online, so the individual will have their own maybe one-to-ones with a nurse or their dietitian. They'd have their snack on their own, and then we'd have the first group here at 11 to 12:30, which would be the nutrition group with the dietitian. And then you'd go off and have your lunch, and then we'd have the nursing group, so which would be promoting a positive self-image group. And that would be from 2 to 4. And then there's an optional anti-tension group. And then on the Thursday and Friday, which would be on site, the mornings would normally be when we would do your medical monitoring, have a check-in, take your weights if it's for that week. Your blood pressure would be taken weekly, and just to have a quick check-in with the nurse. You'd have your snack with everybody else. And then the first group then on the Thursday would be decider skills group, which would be nurse-led. Lunch with everyone, and then we would have your compassionate mind psychology group, and that would be with the psychologist, and then we'd have our snack together as well. And then the last day would be a Friday on site. Again, we have our medical monitorings, your blood pressure, your weights, and then we'd have your community group with the occupational therapist, and that could be a baking group, going out to get a snack, an activity, and the group decides together what they'd like to do that day. And then there'd be lunch together. And then lastly, we'd have, which is optional, it would be a goals group, looking at weekend planning, goals that you have for yourself for that weekend or the week to come, and that would be nurse-led, and then we'd have our snack together as well. So that's basically it from me, just a run through of the BED program, and thank you for your time this evening. And here are some references then.
Thanks, Claudia. Thanks, Michelle. That was really, really interesting. Thanks so much for your time. I wonder if the two of you, I'm conscious it's gotten so dark since we started, and I have like a lamp in my face, so apologies if that looks odd. We've gotten quite a few questions in, Michelle and Claudia, and we just have a couple of minutes to run through some of them. And I'm actually just going to start with a really specific one first. It's got to do with the Rio system and its classification. And some of our participants are wondering, you know, why hasn't that been updated to reflect the current diagnostic framework? Like one attendee is saying that their BED is coded as eating disorder unspecified, and they're wondering, you know, why is that?
I absolutely appreciate that, you know, it's not just with eating disorders, it is across the board that I suppose that's down to the Rio system and a systemic update needed across the St. Patrick's service to recognise the updated DSM ICD codes and diagnoses there. So we do our best to kind of make the service users aware of their diagnosis. Unfortunately, the system it isn't as updated as us, but we always try to be as clear as possible to the service user about their specific diagnosis, even if the system is a little bit behind in that regard. So while it, like I said, we're limited by the codes that we can use on the system, but we would always align the diagnosis with the person and explain their diagnosis as clearly as we can do to them.
Thanks for that, Michelle. Somebody's wondering, can a GP diagnose BED?
I suppose theoretically, yes. And I'm sure if there's any GPs online tonight, please chime in too. I'd appreciate that. Technically, yes. However, I know a lot of GPs would refer on for specialised assessment, be it through ourselves or through the HSE services, for a formal eating disorder assessment to take place. And, you know, similarly to a lot of the feedback that we get from GPs is that they unfortunately don't have the time in their slots these days to kind of do a thorough assessment. And service users themselves feel that pressure that, you know, they may go in for a specific reason and may not have the time to explain all the various symptoms and things like that they're going through. So that's why it commonly is a specialized service like ourselves or a consultant psychiatrist that would diagnose an eating disorder or binge eating disorder in this case.
I mean, Claudia detailed the daycare program so well there and gave us such a good sense of what it would actually be like to be on that program and what the various different components would be like. And unsurprisingly, a number of the people attending are wondering, how do I get on that program? How do I access that? And what are the processes there?
I can, will I speak to this, Claudia? Yeah. I think it's a referral into the eating disorder service in St. Patrick's. The referral process is that all referrals are reviewed by the eating disorder team, and there's a member from the day services there too, along with our Dean Clinic coordinator as well. So they're reviewed, and if someone seems suitable to be referred directly to the daycare program, one of the members of our team on the daycare program does an assessment at that point. A decision is made then if there seems to be more complexity or if there's a need for other treatment or a more enhanced treatment like inpatient or further assessment, they're referred there. But absolutely, they can be referred in and come directly to our to the daycare services. And for the binge eating disorder program, we've met many service users that have accessed the binge eating program through that method.
You mentioned in your presentation, Michelle, about how sometimes binge eating disorder there's sort of comorbidities, or it might present alongside another mental health difficulty. And one of our attendees is wondering, their diagnosis is severe recurrent depression, but they're wondering, would it make sense to almost, for want of a better word, like to have a module on binge eating as part of their treatment, because it might be sort of a particular system or a symptom of the expression of their depression, perhaps?
Absolutely. I think that if they're noticing that themselves, I'd encourage them to speak to their clinician, speak to their team about that, and ask for an assessment. If they're linked in with St. Patrick's, there's various members on our team and the extended team that would be able to kind of go through an assessment with them. But as I was trying to highlight, is kind of the importance of having a diagnosis and being able to access a suitable treatment pathway for binge eating. And as you said, you picked up the comorbid diagnoses are quite prevalent with binge eating disorders.
There's somebody else here wondering about, I guess, the idea of picky eaters, and if you have picky eaters in your family, and if, I mean, it sounded like from your presentation, BED sort of grows out of perhaps emotional distress, or as you're saying, interpersonal difficulties and things. But somebody's wondering if somebody is a picky eater and therefore eats a restricted selection of foods that may be perhaps more on the end of high calorific foods as distinct from low calorific foods, which aren't maybe necessarily as filling. I'm not sure that the behavior could develop that way, or is that not, does that not tend to be a pathway towards BED?
It is very difficult to say, you know, it is really difficult to pinpoint it, you know, does picky eating lead to any form of eating disorders? It is really, really difficult to say. I think it's looking at the particular type of eating, kind of looking at if the period of time, looking at the criterion there, even that I kind of put up, that if there is it is, you know, as a mother myself, there's always going to be concerns around kind of the food with children and how they're eating and what they're eating and how often, or trying to find that balance. But I think it's, you know, the fact that they're aware and asking a question, it's noting it, noting how long it's going on for, and seeing if there are different things or if different supports, you know, even looking at some of the books and reading some more up on it, and seeing if it is. But it's, like I said, it's a tricky question, and definitely not a straightforward answer. So I'm sorry I couldn't be clear on that.
No, and in fairness, in the presentation, which obviously the attendee who asked the question will receive the slides for, there was a very helpful slide that sort of listed, as you say, the criteria around, you know, things like eating in isolation, or the prevalence per week, or the duration of these binges or whatever. So,
and again, like eating when full, overeating, kind of eating in secret, you know, eating large volumes of food that they are aware that's large volumes of food, that the feelings of distress, the feelings of discomfort, shame, things like that. And it can be difficult to kind of relate that to children and get them to explain. But I think, you know, it's like I said, worth going through that criterion and seeing if there are things there that can be addressed.
I'm just conscious we've oodles of questions, and well, it's not even fair to say we're running out of time. We have run out of time for this slot, but I'm just, one or two that have just jumped out at me. Somebody's wondering, they're incredibly complimentary of the staff and the care on Stella, but have found themselves that they found it quite triggering to be around others with different eating disorders. And I'm just wondering, can you speak a bit about that, about, I suppose, why sometimes programs have mixed eating disorders, and also how that can be helpful and perhaps challenging for people? I'm all with the hard questions this evening, Michelle, sorry.
I'm laughing, as always, the hard questions as one of the last questions as well. So I suppose Stella Ward is one of our general psychiatry wards, so it's not one of our eating disorder specific wards. I wouldn't say one of, we only have one eating disorder specific ward in St. Patrick's. So this kind of aligns with people with eating disorders or eating difficulties having comorbid diagnoses, and being in a ward which can be challenging when people are eating normally, people are eating abnormally, people are eating, you know, having eating disorder behaviors. It is a challenge. But again, I think it's looking to seek supports around that. We have, like I said, various members of our team can do an assessment to see if there is a place for their needs to be met with our eating disorder team, be it having extra supports on the ward. You know, we are looking at kind of doing more education sessions with the nurses, generalized, because we recognize that we're very, I suppose, educated, and the training for eating disorders are specific for our eating disorder staff, but we do recognize, like that service user, that there are people with eating difficulties on the other wards, and we want the nurses to be able to help and support them as best as possible. So we are looking at kind of training staff to be more aware and more kind of specifically trained in that regard. So
I'm conscious, as you were chatting to us, and Claudia too, it's so difficult because whilst there are criteria against which to diagnose things, and there are through lines in terms of, as you're saying, Claudia, structuring treatment and allowing for on-site and off-site and flexibility, there is such a personal aspect to it. There's only so much of it that's going to conform to criteria. There's a massive part of it that is unique to the individual, which is very challenging, I'm sure, in terms of trying to design treatment plans, etc. for those. I would just say we're going to wrap up this section now, just so that we can have a little 5-minute break for everybody to just take a pause before we come back for our other panel discussion. But just to say, Fiona has shared a link in the chat that goes to the information page on St. Patrick's, and a number of the questions that have come up a few times are answered there. If you asked a question that didn't get answered, I can try and ask a version of it at the end of the panel discussion. But alternatively, if you email it to communications@stpatricks.ie, then the team will certainly follow up on those in the coming days and hopefully get you an answer or liaise with you on that. It's certainly not our intention to ignore any answers. When the questions are coming in like this, there's just no way we can sort of get to all of them. So I hope you feel we've made an honest stab at trying to answer as many as possible. And certainly Michelle and Claudia, when the questions come in, it's proof that the presentation has been meaty, because people have things they're engaged, they have questions they want answers to. So
and thanks, Jan. And as I said, for anyone who did ask a question, absolutely send the email in. I'm more than happy to answer. If I can't answer it, I'll get one of the other team members to answer it. And I know Claudia will be something similar. Yeah. So
thanks, guys. Well, look, thanks for giving up your time on a random Wednesday evening in March, and we appreciate it. And we'll just take a pause now, everybody, for about 5 minutes. So I'm just looking at the time. Oh, I've gone way over, sorry. If we meet back here at, what would that be, sort of 18:53 or 4, we'll try and get started at 5 to at the latest. If you could join us back at that time, that would be great. Thanks, everyone. You're welcome back, everybody. Or if you're just joining us for this second part of the event, you're very welcome indeed. Thanks to you all who have been online so far, and all of your great questions and for your engagement. It's very much appreciated. So for this second session of this evening's event, we're joined by 3 experts by experience, Sean, Hannah and Karen, as well as Kira, who is a social worker on the St. Patrick's Mental Health Services Eating Disorders Service. So these 4 people are going to be on the panel. I'm going to ask them some questions. You're welcome to put questions into the Q&A box for them. You can, if it would help me, if they're the particular person that you'd like to direct your question to, if you include that in your question, then it'll help me to sort of direct it to the right place. But really, we're going to have a chat about support, stigma, knowing when, you know, you might feel that something was off and you might have needed support, those kinds of themes. But I'm sure we'll have a really good and useful discussion, and I'm sure we're not in a room, obviously, where we can all, you know, applaud our 3 experts of experience for joining us. But I'm sure you are all welcoming them and very grateful for their time, which I am, and everyone on the team at St. Patrick's is. So Sean, Hannah, Karen and Kira, if you all put on your cameras and unmute yourselves, and we can get started. Hi Sean, I see you there.
Hey, how are you?
Good, thank you. And Kira and Hannah and Karen, I can see everybody now. I think I maybe didn't have the right gallery view, and I was sort of just looking at myself, which was a little disconcerting. So thanks very much for joining us. You're great to come on a Wednesday evening. I suppose we'll start with a sort of fairly general question, but it's just for people to get a sense of, you know, maybe how long you were having difficulties or feeling that you had these challenges around eating before you decided to seek help. Maybe if we start with you, Sean.
Well, funny, someone actually asked me the other day, said to me, how long were you sick? And I had to think about it, and I actually just said all my life, really, because all my life was a dark shadow, really, up until the time I went into St. Pat's, into Clara ward for eating disorder. But I suppose, look, I found something many years ago that I was good at, and that was it was basically exercise and you know, the societal norms that we follow about low calories, low sugar, and what way we should look, and what's good and what's not good to eat. And I fell into that big trap. And as things went on, you get your usual congratulations from people and everything. And I was good at something for once, and I didn't want to let it go, and it just spiraled from there. You know, it went on for years, and my wife had spotted it many years ago, and I went to the GP, but the GP just said, look, it's you being healthy, and there's nothing wrong with that. So another few years went on, and I went back again, and it was kind of diagnosed as OCD. And then a little bit more time, I went back and got a therapist. So eventually the therapist said to me, you're really, really sick. And she actually turned around to me and says, you know, you're anorexic. And of course I was like, you know, so she told me I needed to go back to my GP straight away and get a referral. So I did. I went back, and then I went into St. Pat's, really. That was my beginning of my journey. But I suppose there was the time I knew, I kind of knew for a good while beforehand, and it's very strange because you kind of maintain it. It's weird when I say it because you live with it and you do the behaviors and you know what you're doing. I mean, like, I kind of realized just from listening to other people, simple things like lived experience and what I was doing, and something that I never really used to say a lot, but one thing I used to do a lot was I'd look at food. I'd walk around shops and I'd look at food and stuff, and that became normal to me. I dropped my little girl off to ballet on a Thursday, and I actively go and do this. So I lived with it, and I knew then. So I got so bad that I went to my wife, and I just said, look, I think I have a problem. And I didn't know what to say, so I just said I have a problem with food. And it went from there, really. And that's when the journey kind of began, when I said, right, I need help, I have a problem. And
did you, just as you were outlining it there, Sean, did you need somebody to say to you, you're really sick, for you to be able to sort of own it?
I kind of needed that. For me, I needed that to be told. It's funny, like deep down in you, and deep down, I wanted to be told. And deep down, I wanted to be told I had to come in as an inpatient. But it was like I was down the bottom screaming up, and the eating disorder had taken complete control of me. So I I did need it, and I needed, from me personally, I needed to be under control. I needed my control to be taken away from me because I wasn't going to stop. And like, I would have chosen it over my family, over everything, and I can sit okay with that because I know it wasn't me. So yeah, no, I definitely knew, I suppose, at that stage, but I definitely needed someone to tell me, because I needed that validation, I suppose, to be told.
Yeah.
Because you just don't believe it. And like, for me, it was just like, so many people had said it, had kind of said things. But the funny thing is, the amount of people afterwards who have said to me, oh, I kind of knew by looking at you, you know, and especially after the documentary was shown, the amount of people that said it to me, and they were just afraid to say it to me before, you know. So it's just kind of one of those things, I suppose.
Hannah, what about you? When did you sort of feel like all is not well here?
It's funny, as Sean said it, like, he said that he felt that he'd been sick his whole life. And I definitely can relate to that in the aspect of having kind of poor coping mechanisms, or I suppose using food as coping mechanism. And I think that's how it all started with me, to be honest. But when I realized that I had an issue, I suppose when I was hiding things, and I was really defensive about food, and yeah, I used to eat in my car before I'd get home or on the way to work, and it was all hidden. It was total secrecy, and the shame around it. And that was only because I was feeling so unwell in myself, like depression wise. And it was when I was being admitted or assessed for admission, not to Clara ward, but just to a normal psychiatry ward. And the consultant said to me, you know, what about your eating? How is that? Just as a general question. And I suppose because I'm overweight, it kind of came up. And then when he said it to me, you know, that's good, I'm going to be diagnosed with, I know somebody else said it earlier on, eating disorder of, I don't know what the
Oh yeah, it's like nondescript or something.
Yeah,
Yeah.
And I was just like, right, another thing to add to the list of what's wrong with me. But it was also kind of like, oh, like, it's not just me not having willpower, or, you know, it's not me just like, yeah, there's actually something behind it.
It's not a failure in you. It's not within your control. It's bigger than you.
Yeah, and it really was. It really was at that point. So yeah, it was similar to Sean. Somebody had to say it to me, but it had to be a professional. It couldn't have been a friend. It couldn't have been family. It had to be a professional for me.
Yeah. No, I get that. Yeah. Karen, what about you? When did you have a similar sort of moment to Hannah and Sean in terms of realizing this is actually at a level of severity where I'm going to need some help here?
Yeah, similar to both Hannah and Sean, I believe I've had it all my life. Like, maybe not since day one, but definitely from about age of 11, I would say. I kind of used food for comfort, or you know, anytime I was having difficulty or anything like that. And like, throughout my teenage years, I would have gained a lot of weight. I would have lost weight, gained weight, lost weight, gained weight. I was never stable. And then I'd say maybe around 20 years ago, I had like a really bad, I won't say it was a full breakdown, but really bad anxiety, depression. And that was my first experience being referred to a psychiatrist in the HSE. And at the time, I wasn't diagnosed with an eating disorder, but over time, during my treatment for anxiety and depression, I was still kind of losing weight, gaining weight, losing weight, gaining weight, and just getting nowhere. And then eventually I lost so much weight that I was actually underweight. And everybody was saying to me, oh, you've gone too far, stop. And I really didn't want to be hearing that from anybody, because as far as I was concerned, I still had a few pounds to lose. And I said this to the psychiatrist when I was there. I was saying, I don't eat very much. And then after about a week, I have this massive binge. I can't control myself. I feel awful. It's to the point where I'm uncomfortable, and I can't get out of bed for about 2 days afterwards because I just feel so disgusted. And the psychiatrist at the time said, it sounds like you have binge eating disorder. And I thought, okay. I didn't believe him because, I didn't think, I thought only like supermodels or, teenagers had, eating disorders. I didn't really believe him, but I kind of sat with it and thought, okay, and nothing happened. And then another few months later, I asked about, is there anything for the binge eating disorder? And the psychiatrist said, just go home and kind of get some materials and read up about it. There isn't really anything that we can do. And I just thought, oh, what's the point of me even coming here? So I actually discharged myself. I felt I was getting nowhere, wasn't doing anything. So I kind of went it alone for a while and started gaining weight again. And I just thought, this is just crazy. After another couple of years, I asked my GP to refer me again to a psychiatrist because I needed help. I didn't really know 100% what the help that I needed was, but I was obsessed with food. I was absolutely, I'd wake up in the morning, I'd be thinking about food. Sometimes I would eat, sometimes I wouldn't eat. And I just needed help around kind of figuring that out. So I went back to a psychiatrist and I got referred for C80, I think it's called. Not around the food, but just around managing anxiety in general. And this woman was amazing, this psychologist I went to. And she said, and I was saying, look, and I have binge eating disorder and there's nothing anybody can do about it. And she says, what do you mean there's nothing? And I was like, well, the psychiatrist said there's nothing. And she says, well, that's not strictly true, And luckily, and like, I'm so lucky, I actually have private health insurance. That's the only way I actually got help in the end. This psychologist, who was absolutely brilliant, said, look, I'll find out information for you. I'll go and find out what's available. And she came back with the St. Pat's CFTE program. And she says, why did you never ask about this before? And I was like, I never knew it existed. I never knew I could. I've been going all these years with nothing. And so, yeah, I got my GP to refer me to St. Pat's for the CFTE program, which kind of started off my journey. And one of the first things that they said to me on the CBT program was that it was not your fault. And I just was like, it's not my fault. It's not, I'm not a disgusting person. It's not my fault,
It's interesting you make that point, Karen, and something struck me, obviously, when you mentioned, the supermodels, and Sean, when he mentioned about people complimenting him when he was reducing his weight, and Hannah saying about she needed to hear things from the medical professional as distinct from the noise that exists in our culture around food, around bodies, around sizes, around shapes, around weight, around loss and gain, and all of this stuff. We sort of almost fetishize weight loss. And Ciara, I'm wondering, is the sort of stigma that can exist around eating disorders, is that sort of fueled by that fetishization in society, do you think?
Yeah, I think so. I definitely think that I suppose we can't close off to that. We're all kind of hearing that noise all of the time. And I think if there is, I suppose, a predisposition or something there already, it's going to further compound people's difficulties. So I think that definitely does contribute, I suppose, to the stigma. And really, I suppose, just underscores the importance of having kind of up-to-date information around, I suppose, eating disorders and understanding them, I suppose, better, really, and understanding, I suppose, the seriousness of eating disorders, that they're not a choice. And I think that's so important, I guess, in that kind of when we are trying to support someone, that kind of shines through in our ethos and in the conversations, and can be our own individual way in trying to kind of tackle or debunk some of that stigma, I guess, that people do feel in very real terms.
Well, I was struck in Michelle's presentation when she was talking about how underdiagnosed it is.
Yeah.
And, we've developed in recent years a better understanding of things like depression and anxiety, and people have a lot more education and understanding around that, and would more than likely not say to somebody now, oh, for God's sake, get over it, just smile, get up, come on, get out, and do that. And yet the level of awareness and understanding of eating disorders isn't as developed, and people will often say, well, can you not just control yourself, or can you not just, which is just, it's awful, but by the same token, it goes to show how far behind we are in our understanding of that. I mean, Hannah, you were nodding there. Have you experienced that kind of stigma?
Yeah. And I can laugh about it now, but at the time I was horrified. And this was from a family member, and I know they were really well-meaning.
Sure.
They had said to me, God, Hannah, you're very knowledgeable or educated. You've 2 degrees. Why can't you get over this? And I was just like just, at the time I held it together. I didn't give out to the person, but I was just like, that's the thing. It's not a rational thing. Yes, I may have 2 degrees. That was a rational part of me that was able to go in and do that. But this is not a rational part. So even they meant well and whatnot, but yeah, there is very much I suppose a stigma. It's just like what, just get over it. It's just food, And I think just from my own experience of binge eating disorder, I suppose I relate to it as I used food as a bad coping mechanism, as a comfort, similar to the way addicts use. And that's the way I see it for me anyway. But you can give up whatever substance you might be addicted to, but you can't give up food. And I think a lot of people don't really think that it's something that you're surrounded by all the time.
Yeah.
And you can't really avoid it. You can't. So yeah, I think for me anyway, I found that there's stigma, definitely.
What about you, Sean? I'm conscious, oftentimes in particular with anorexia, people have stereotypes of teenage girls that they associate with that. And I'm sure a lot of that came at you as well as everything else. But would you say that the stigma in any way was a barrier to you getting treatment, or might have even delayed your sort of ownership of the situation? How did it affect you, would you say?
No, funny enough, I do get asked that. It actually didn't, because I was so sick. I just wanted help. I didn't care, because it is, and it's like Hannah was saying there. People, they do have a misunderstanding of it. Why can't you just get over it? But and I do find it, at the end of the day, if it's shot, when I say that I was willing to give up everything, I was willing to die basically, and walk away from my family and everything, because it had eaten me away so much, thinking that I wasn't worth it. And if that doesn't show people that it's not a choice, I mean, what does? It's and when it comes to even now, I did find it hard to say anorexia for a while, because obviously, but I kind of own it now, and I'm proud of it, because it was what it was, and you know what I mean, and it happened, and as I said, I'm actually proud of where I am with it now. I mean, when I went in to St. Pat's, when I went in, I was the only male there, and do you know what? At the time, I didn't even notice, to be honest with you. But everyone in there was amazing. Didn't treat me any different. And while I was in there, they all got me through it just by being there. You know what I mean? Because when you hear of other people's experiences and things, but look, I'm sure there's people that I did have people after the documentary was on. One person said to me, I didn't know anorexia was a thing anymore. Another person referred to Karen Carpenter. They thought, you know what I mean? So,
yeah.
So it's kind of I haven't faced any as such, to be honest with you. And I kind of speak out about it a lot. I'm very kind of open about it because I did spend a life of massive self-hate and didn't speak, kept quiet. So every opportunity I take now, I take to educate people about eating disorders. And like, it's amazing a 5-10 minute conversation can do with someone, you know.
Yeah, of course. Yeah.
So and again, CFT was a massive turning point for me because.
And that's the compassion focused therapy.
Yeah, like, I mean, again, it wasn't one of the first things, but it wasn't my fault, you know what I mean? And to find that compassion for myself. And look, I mean, like, I'm doing things I never thought I'd do in my life, do you know what I mean? I love speaking is my kind of recovery path. It's helped me fight back, you know? So it's incredible, like, you know what I mean? What, for someone who was so full of hate for themselves and embarrassed to speak, to say anything, you know, I've done so much. I mean, my biggest thing of having an Instagram account and I posted on, like, that's bigger than anything I've ever done in my life. It was the most frightening thing I'd ever do. And even doing the documentary on RT, that doesn't come near to doing the social media thing because I didn't grow up with it. So I'm just, you know, and it's kind of the stigma thing is there. I'm sure maybe people don't say it, but I don't care because, do you know what I mean? It is what it is. And as I said, I'm proud of it because I've met amazing people.
Well,
and,
and that's should be,
you know,
because, you know, based on how you tell it, you know, not to borrow an analogy from addiction, but you were at a rock bottom. So, you know, as you should be, proud to have walked through that particular experience. Karen, what about you? You know, Sean touched there on some of the things that help him to maintain his recovery. What are some of the things that you lean on in your recovery?
I suppose a routine is very important for me. Kind of having a regular kind of check in with myself and actually asking myself, you know, am I doing okay? I have kind of a good support network now, which I didn't really have before because I was so closed off and I didn't speak to anybody like for a long time. So, but I've met a lot of people in recovery from binge eating disorder, and I've actually made some good friends. So I do rely on them, and we support each other, which is great because we can say things to each other that we would never say to another living person, you know, because we know they get it. We know they understand. They're not going to be shocked by something that we've said or done or thought. So that's really, really important. And I suppose kind of keeping perspective on things, you know, like, you know, I mean, I have bad days, obviously, or, you know, a bad few days or even a bad week. But I think the one thing that the treatment has given me is the kind of sense of hope that, like, no matter how kind of bad it gets, that I'm never going to be back where I was in the beginning. I can't unlearn the things that I already know, and that I will have the strength to kind of get back on track and get myself out of it and get out there and make connections and meet people and get busy and look after myself.
It's, you know, when you all talk about the compassion focused therapy, as you talk there about having hope and about being gentle with yourself around, well, look, just because I've had a bad day doesn't mean the whole thing's gone to hell in a handcart. It feels as though, Ciara, acceptance is a really big part of recovery from an eating disorder. And certainly, like, you're also interesting to chat to. I was just chatting away and had completely ignored the questions in the answer box. So it's sorry to everybody who was asking loads of brilliant questions. I'm going to try and get onto those now. One of the people who'd asked a question was saying, you know, how hard is it to get over the hump of making it about weight loss or weight gain in the case of somebody who has had dramatic weight loss as part of their disorder? So I'm just, you know, that whole road of trying to accept where you are, be compassionate with where you are, and not be sort of, not let the food noise and the weight loss noise, etc., drown that all out. Is that a common challenge, Ciara, do you think?
Yeah, I think so. You know, I think that is, and I suppose our hope is that lessons as the recovery journey, I suppose, goes on, and people feel, I suppose, start to kind of reap some of the rewards of their recovery. And just even listening to Karen there, just feeling more socially connected and having a community, and, you know, having some bad days, but overall better days than worse. You know, so I think as as our life starts to open up again, I suppose that it's balanced out. Some of those pieces can stay with us, but they're more balanced out in this broader picture. That recovery kind of really allows people with eating disorders to access or to gain back. So I guess that's kind of the hopeful part, that while there may still be a little bit of noise there, there's so much more to be gained, and that lessens the further along into the recovery journey that people, the further along that they get.
Yeah, sure.
Yeah.
Somebody had a very practical question there that sort of leads us on to the area of support, and whether it's family support or friend support or just your individual support network. Someone was saying if any of our contributors had advice around, you know, if you had somebody, say, that you were living with or in your family who was living with, say, binge eating disorder, and they were on the brink of a binge, or if they were with a purging type disorder, if they're on the brink of a purge, is there something they can do in that moment to support that person? And I just want to acknowledge, in the asking of that question, I'm sure it's so difficult for people who are trying to support, and all they want to do, as you said, Hannah, the person who said to you something that they probably said from a place of wanting to help, but just didn't realize how kind of tone deaf it was at the time. But I just want to acknowledge this person obviously really wants to be there for the individual that they're supporting. But is there anything, maybe Hannah, Sean, Karen, any of you, that you think in the moment or at the time that somebody can do to help you?
From my point, but what I'd say anyway, and someone asked me a similar question the other day. It wasn't directly related to behaviours, but it was just about supporting someone, or you might recognise that someone you love or someone close to you might have an eating disorder. But what I would say is get as much information about it as possible, because I suppose you have to, as someone who doesn't understand it, you have to be careful not to, like, saying the wrong thing can just completely, like, cause a lot of stress. And also, as we said before, it's not a choice. So, like, you're not going to be able to stop it by, you know what I mean? So to get as much advice as possible as to how to talk to someone who is, you know what I mean, who does have an eating disorder. Because I suppose when my wife, she knew, so she never tried to, because she knew she had it, it wouldn't have worked, it would have pushed me further away. So yeah, sorry, Hannah, I know you were going to talk there.
No, like everybody's advice is important. Yeah, the only thing I was going to say, two things. One is to approach the person in a really compassionate way and to have no criticism, because the criticism that the person is putting on themselves is worse than anything you can imagine. So try to come without any criticism. And then I suppose one of the decider skills, that we learn is actually when you're getting I suppose the urge to partake in behaviors is to distract. So try do something to distract them, like anything. If it's something that they like, crafty, if it's telling them a bit of gossip, you know, something, you'll know the person better than most. So maybe something like that.
Just to kind of derail a little bit.
Yeah. We talked about it a lot in group, is putting in a pause is so important, like the stop decider skill. You know, it's putting in that pause so that they can have a moment to just breathe and let those urges go. But approaching it in a way that isn't critical or criticizing them. It's just so important.
It's so interesting, like the interconnectedness of all the points that you've all made along through the conversation of, you know, not wanting to be judged, not wanting to be judged, just like it's completely undeserved and utterly unhelpful. So like there is no place for judgment, but also that each of you mentioned the notion of being the relief of being told this is not your fault, and somebody seeing this is beyond your control in this moment. So I can appreciate for supporters, you always have that urge to want to help, and that feels like a doing thing. But often there can be a lot of help and support in just bearing witness and just being a safe place to land for the person. Karen, what's been your experience of support that you found particularly helpful?
Well, Well, my experience is slightly different in that I didn't tell anybody I had an eating disorder until I started the CFTE program, and then I only told my husband. I didn't tell anybody else, and that was like a year-long program I went through on my own. And he was supportive, but he didn't understand, and I didn't want to talk about it. So I didn't get to the point of actually seeking support until I was hospitalized and on Clara ward. Went through that whole inpatient thing and came out and did daycare. And it's really only since then that I've been able to, connect with somebody and say, look, I'm having a bad day, or what do you think about this? Or, I'm struggling. Have you any suggestions or anything like that, So it's a relatively new experience for me now, asking for help.
Well, but I mean, having gone from being somebody who didn't tell anyone and just about told your husband to be here sharing your experience with people, and this is massive. So like,
I know
that, and well done you.
that is a symbol though of how far that I have come. That I can be on here in public, you're talking like this. When before I was just like, don't even look at me, don't even look, So yeah, I have come a long way, and I suppose now I can say to my my husband and family and friends, I can say, yeah, I'm doing okay, or actually I'm struggling a bit, but I'll be okay. So they're supportive in that way, in that they're there to help me if I need help, but they don't kind of push me to kind of open up if I don't want to, which suits me for where I'm at this moment in time.
Yeah, well, it's great that it's at your pace, and people respect that, which is great. I'm conscious of the time, and we're sort of drifting close to finishing up, and I just suppose, is there anything that we haven't talked about? I mean, we always sort of end by saying, is there something that you would say to somebody who's in the grip of eating disorder now, or who's in the thick of it at the minute, that would be helpful to them? So please, if there is, share something like that with us. But also, if there's something you haven't had a chance to say that you'd like to say, any of you, please be my guest.
Yeah, I think if somebody, what I'd say to somebody is, I didn't get help until I was 50, but I've struggled with it all my life. So if somebody feels that they need help, like, speak to somebody, you go to a GP, insist on being referred for assessment, or at the very least to go for counselling or something where you can start a process of some sort of recovery. Don't wait, don't hope it'll go away, because it's not going to go away. It's only going to get worse. So I would say do something now, even if it's something small, just to get you started.
Yeah, great advice. Sean?
Yeah, 100%. I mean, what I'd say is definitely to try get help. Just speak, because I suppose the earlier you might get help, the better. I mean, I never thought I'd be where I was now, and like, what I will say to people is, it can get better. It is. I know it might seem, if anyone's listening, it might seem absolutely impossible, but it hasn't just like helped me with my eating disorder and eating disorder behaviours, as Ciara pointed out earlier on, with food noise and stuff. That gradually does improve, and like, there are bad days and good days, low moods, and a lot of stuff comes after that, but it can get so much better. And we all deserve that happiness, and we all deserve to be, to enjoy life. And it's really, really important that, I suppose, you speak up and get that help and talk to someone, because, like, just talking to someone can make a massive difference. I mean, the amount of people I've met is incredible through everything I do. Like, I do a lot of other voluntary work in Shine and places like that, and it's a big thing. So just talking to people who might understand, it's amazing the difference it will make.
Yeah. Hannah, what about you? What would you say to somebody who's in the grip of it at the minute?
So one analogy that I use often is, if you think of a messy room and having to clean up a messy room, sometimes it gets messier first before you start to clean everything away. And that's kind of what recovery can be like. it can be really difficult. But when you start to clear things away, God, the relief, and then you start to actually be able to give yourself that little bit of compassion, and you're like, oh, and then you just know, you start noticing things. It's a very gradual process, but it's so worth it. So it's just an investment in yourself, really, in time. But it is so worth it. So just stick with it. Like, the three of us here, we've been through it. That messy room is not nice to clean, but you can come out the other side. You definitely can.
Yeah, and as Sean said, you deserve it. Like, everybody is deserving of that enjoyment in life and being able to live the life that they wish to live on their own terms. So I think you've all really, I mean, I know it's an overused term, but in its truest sense, I think you have all inspired people who have joined us in terms of participating this evening, particularly in that aspect that, like, yes, this is difficult, and yes, it's multifaceted, and yes, it may be lifelong, but it's absolutely worth it because you deserve to live the life that you want to live. On that note, I just, we're kind of just about over time, but just to say that thank you, obviously, to everybody, to Sean, to Hannah, to Karen, to Ciara, to Michelle, to Claudia, all of you for joining us. I really appreciate it. And certainly there was a lot of love coming in on the Q&A with people basically just saying, God, they're great. Thanks so much. It means a lot, and finding all of your advice really useful and being able to empathize. So I would encourage you to read through some of those and you get a great L boost for yourselves. Sean, a few people were wondering if you wouldn't mind sharing your Instagram handle so they can go and follow you over there. That would be great.
Yeah. I don't know what it's Sean Blake 80. I can type it in.
Sean Blake 80, perfect.
Yeah.
One of these random ones, like.
I was born in 1981, but someone had that already, so I just chose 80. I should have went 82 to make myself a little bit younger. But
another thing, just to say that obviously, we have been recording this presentation and it will be available in the next few days, and the team in St. Patrick's will send out the slides to everybody who joined us this evening. But one other thing just to mention, if you have been with us for the presentation and you've sort of maybe a few things have been ringing a few bells and you'd like to learn more about the eating disorder service at St. Patrick's, and I know a few people in the chat were talking about, maybe wondering would their GP be able to diagnose or refer them, or what the process would be. If you're interested in learning a little bit more, there is a new service. Now, let me just get the exact word. It's a new sort of program. It's a one-day group program for people who are experiencing what we would loosely call eating difficulties and who would like to learn more about recovery and treatment options available. Now, that program, it's delivered by a multidisciplinary team specializing in eating disorder care and recovery. And it also includes, as part of it, a one-to-one meeting with the consultant psychiatrist to discuss a potential sort of proposed care and recovery plan. So maybe in line with what Hannah and Sean and Karen are talking about this evening about taking that step, it could be like a toe in the water to just suss it out a bit more. Fiona is going to share that link in the chat. It's on the St. Patrick's website if you want to find out more about that one-day group program. And other than that, I think, have I forgotten to say anything else? No, we already shared the link as well for more eating disorder information if you want to look through that. And really all that remains for me to do is to thank you all again. Thanks for joining us. Thanks for a really, I know it's not easy for experts by experience to, you've lived it. It's your lived experience, and it's an incredibly generous thing to do, to come on and share that with the internet, in terms of not being able to sort of see everybody's faces. But it's hugely valuable and massively appreciated. So thank you all for that. Thanks everyone who participated and sent in great questions and really great words of encouragement for our experts. And when we finish up, when the Zoom call ends, a little link will pop up for feedback. I know those things seem like they're kind of annoying and like, why would you be doing it? The team in St. Patrick's read them all, and it does impact on how events are designed. So if there's anything in particular that you are interested in, that you like, that you didn't like about this event, please just take a minute to fill out that form, because it really does shape how future events are designed. Other than that, enjoy the rest of your evening and your week, everybody. Thanks so much, and take care.
Thank you, everyone. Bye-bye.